Okay, great. So thanks again for coming. Um, I'll introduce myself first. My name is Laura Santner. I'm a clinical social worker and I've been working with BFRBs for quite a long time. I've been really enjoying working with skinpick.com. So this has been such a pleasure to be doing these frequently asked question webinars. So it's pretty casual. You can write your question and answer your question in the box, the question box. So I will be going over the pre-submitted questions first, and then I'll go over your live questions. Okay, but sit back, relax, have some water with you, some tea, a fidget. My fidget tonight is this cool thing that I found, and it's actually a pen. So make sure you have your fidget as we go over your questions. Okay. Do do. Okay. So again, I'm having some technical difficulties tonight, so hopefully things will go smoothly. So please bear with me. First question: what causes skin picking, and what is the best kind of therapist to see? We get this question every time. It's probably the most common question. So the cause is not entirely known and it's quite complex. So as of now, research is indicating that some people may have an inherited predisposition. Um, but even if a predisposition is inherited, there are other factors as well. So just because you might have that genetic predisposition does not mean you're going to have a skin picking disorder. So other factors could be things like your hormones, temperament, the age of onset, any other co-occurring disorders, and what's going on in your environment and stress factors. So it's caused by a variety of factors, and it's kind of like they're all interacting with each other. Um, so we'll leave it at that for now. I'm sure there'll be follow-up questions. The best kind of therapist is one that's specifically trained in BFRB. So you can find a trained therapist listed on skinpick.com. You can also find them listed on bfrb.org. So you want to look for a therapist that uses a combination of treatments. So there is no one way, one magic answer. It's about finding the right combination for you. So you want a therapist though who is trained in the comprehensive behavioral model or COMB, acceptance and commitment therapy or ACT, habit reversal training, HRT, cognitive behavioral therapy, CBT, um, dialectical behavioral therapy, which is DBT. So it's about that combination of things. Okay. And it's all individualized too. So it kind of depends on your needs and where you're at. Um, on the Skin Pick program, by the way, all of the therapists, we are all trained, we are all knowledgeable, and we are here to help. Okay. Excuse me. How common is skin picking? So, according to the DSM or the Diagnostic and Statistical Manual of Mental Health Disorders, the fifth edition, the most recent edition, it indicates that 1.4% of the population has dermatillomania. However, most recent findings suggest that it's higher actually. So more like 2 to 3% of the population. So that's about 1 in 20 people. So it is more common than you might realize. And in fact, because there's so much shame and stigma and embarrassment about this disorder, most likely more people have it and just don't report it. So most likely the percentage is even higher than 2 and 3%. So something to keep in mind, you are not alone. Okay. I see some questions rolling in. I will, let me just look at it real quick. I'm going to get to your questions um, as soon as I finish the pre-submitted questions. Although I just very briefly skimmed it. And I do want to address, since I'm going to be using the term BFRB often, one of the questions that just came in is, what is a BFRB? BFRB stands for body focused repetitive behavior, and skin picking disorder is a BFRB. So I will answer that real quick because we will be using that term quite frequently. BFRB, body focused repetitive behavior. Yes. So next question, is skin picking associated to a specific personality type? So this has been a more popular question recently, actually. Um, and on our website, skinpick.com, we have several articles on this topic, which I suggest checking out. There's also a webinar on this topic, so check that one out as well. But basically, um, basically a distinct personality type or trait has not been identified, but certain personality traits do seem to have a significant role in skin picking and how a person might cope. So, for example, the personality trait neuroticism may have a strong influence. So, what that means is that someone might have a personality that is more sensitive and more nervous, all right, instead of being resilient and confident. Something to consider. Um, Another finding was that being more introverted has been linked with skin picking. So that means that you may be focused more on your own thoughts and your own feelings and avoid more social situations. So research has found that introversion was linked to increased severity of skin picking, worsening of moods, and higher perceived stress. Um, Again, something to consider and to think about. Conscientiousness um, is an interesting personality trait because it can have both positive and negative effects on a person with a skin picking disorder. So, on one hand, high conscientiousness can help develop structured routines. It can lead to more effective coping. So those are some positive things. But on the other hand, it can also lead to kind of this excessive focus on perfectionism. And we all know that perfectionism can lead to an increase of urges and an increase in symptoms of picking, of the behavior. So you might also want to consider having a lack of consciousness. That's associated with having more depressive symptoms and more impulsivity and higher stress levels. So that's kind of an interesting personality trait with some positives and some negatives. A person who struggles with impulsivity, they might find it more difficult to resist urges, and that immediate like tactile sensation and that sense of relief is more likely to reinforce the behavior. So just some things to kind of keep in mind, but basically, different personality traits play a role, but there is no definitive personality type that is associated with skin picking or other BFRBs, body focused repetitive behaviors. So if you want to learn more, please do visit some of those articles, blogs, and webinars. And it goes into a lot more detail. I'm just kind of giving like a little summary of what some of the research is saying. What constitutes dermatillomania as opposed to common non-problematic picking at acne or scabs? Yeah, so dermatillomania, or also skin picking disorder or excoriation disorder, right? So it has all those different names. It's all under the umbrella of body focused repetitive behaviors, BFRB. So that is where someone, in this case, skin picking disorder, dermatillomania, it's where someone is recurrently and repeatedly picking at their skin. So to the point that there are lesions or injury, and they have made numerous attempts to stop or decrease with no luck, no success. So someone without the disorder might just pick here and there, but have made no attempts to stop or decrease. It might not bother them, right? So skin picking disorder will include things like repetitive touching, rubbing, scratching, picking at, digging, um, and it can target both healthy and unhealthy skin. So scabs, like you mentioned here, lesions, pimples, any other blemishes. Um, so someone with a BFRB, someone with a skin picking disorder is going to be very bothered by this behavior. So even though it might feel good, they're still going to feel this sense of shame and embarrassment, and they're going to avoid certain activities and situations, might impact relationships. So someone might pick, but not have a BFRB, right? So for those people that might pick or pick just a little bit, it's not going to bother them. It's not going to impact their life. So that's the difference. Um, hope that's clear. And if not, ask a follow-up question. Okay. When I go to a dermatologist, what sort of information will they be looking for to determine a diagnosis of dermatillomania? And is there anything I can do to prepare for an appointment with a dermatologist? So it's a good question. I'm not sure if a dermatologist would be the one to formally diagnose you. Usually it's a psychiatrist or your therapist would diagnose you. Um, but maybe a dermatologist would diagnose you. Basically, to diagnose, the doctor would want to know if you're repeatedly picking at your skin, if it bothers you, if it impacts your life, and if it's causing consequences such as lesions, injuries, infections, and if you've made attempts to stop or decrease and it's not working, nothing is working. Okay. So those are the things that they're going to ask you. There's nothing special you need to do to prepare for a dermatologist appointment. I would say just, be open, be honest, be yourself. Let them know what's going on. Ask questions. But if you have specific questions, I mean, you can write them down in advance because sometimes when you're at the doctor's office, they might rush you, or they might make you feel nervous. So I always recommend for any doctor appointment, for any reason, to write down questions. Helpful tip in general. Are there any tips or treatments the dermatologist might recommend to help me break the habit? Um, So the dermatologist is not going to treat your skin picking disorder. They will not have tips or treatment recommendations. That's not their specialty. They're there to help you with your skin, not with the picking disorder. So they're going to be there to help you um, treat and manage your skin. So, for example, heal lesions, right? Treat or prevent infections. Um, if you have acne and acne is triggering urges, they're going to help you treat the acne. Um, they are not going to help you with urges or strategies. So, for things like that, you want to go to a trained therapist. So, again, someone who's knowledgeable and who has been trained. And you can find that through skinpick.com. You can join our program. You can look for a list of providers on bfrb.org or skinpick.com. Um, there are unfortunately not too many providers out there, um, but they do exist. So take a look. Okay. um, Another question that came in. I'm constantly scanning my face. I can't stop. I don't think I've had a break from open sores, yep, for over 4 years. The ones that cause me to pick the most is the sensation or the feeling like I have grains of sand that I need to get out. And I think I've tried every skincare ingredient and gave them a chance using them over 4 weeks, etc. Nothing is helping. I feel like if I can clear my skin once, I could keep on top of it. Can you recommend any skincare, or is it best to keep it simple? Anything for faster healing too? So BFRBs like to trick you into thinking that you can clear it out, right? Once you clear it out, once it's smooth, once that grainy feeling is gone, you're not going to pick anymore, right? That's not true. You know that's not true. Once you start, usually you can't stop. It's really hard. It's part of the disorder. It's part of the nature of the disorder, unfortunately. So, so I am not a skincare expert. Um, so I do recommend consulting with a dermatologist, especially if you've tried a lot of products. Ask a dermatologist and see what they recommend. Um, I did speak to a dermatologist very recently at the TLC annual conference as this question came up. So interesting that the dermatologist did say, keep it simple. So they kept reinforcing and were very adamant, keep it simple, keep it simple. All these fancy products are just expensive and they don't work. So their recommendation was actually Vaseline. Right. This dermatologist at the conference was really going on and on about Vaseline, also known as petroleum jelly, and all of the benefits. So Vaseline was highly recommended. Um, if you do use other products besides Vaseline, make sure that they're fragrance free. Okay, that was another thing that they were really reiterating. Um, Fragrance free. Um, so yeah, keep it simple. For healing, um, the dermatologist at the conference was mentioning hydrocolloid, right? Hydrocolloid dressings. So that's highly effective and really great. And also pimple patches if your marks or lesions are small or for pimples. Um, what I really like about uh, patches and bandages as well is they also act as a barrier. So they help heal what's going on with your skin and also block your hands from picking them further. But basically, in terms of healing, keep the areas clean, right? Make sure they're clean and you're changing the dressings often and washing your hands. Okay, I think that's actually the end of the pre-submitted questions. So I'm going to go over here to your live questions. And just as a reminder, I'm not going to be able to call on anyone. I see some raised hands. So if you have a question, just write in the question box, and we'll do it that way. So let's see. Hi, I just threw away my magnifying mirror. Yes. It felt so good as I was inspecting my face daily with skin picking. Do you find not using a magnifying mirror a helpful thing? Oh, yes. Do not use magnifying mirrors. Um, you are correct, right on for throwing it away. You do not need to see that closely. It will not do you any favors. Mirrors in general are really big triggers. So even if you can stay away from regular mirrors, like covering them or changing the lighting around mirrors, I would highly recommend that. But magnifying mirrors, big no-no. Definitely throw them away. Right. Get rid of them. So glad that you did that. Right on. Okay, so I answered this question already. Um, I pick skin bumps, scabs, irritants. Dermatologists have said, oh, you're a picker. I don't think I'd pick if there wasn't something to pick. Okay. I think we cut out there for a moment. Sorry about that. Um, Let me get this box back up. Okay. Sorry about that. I know we just cut out. So I will repeat the question. Um, I pick skin, bumps, scabs, irritants. The dermatologists have said, oh, you're a picker. So I don't think I'd pick if there wasn't something to pick. I'd like your perspective. So to repeat my answer in case it got cut out, um, is that I don't know, because when you have a BFRB, sometimes you're picking at something, um, like something actually is there and it's bothering you or interesting, or you want to make it smooth. But sometimes it's a perception that something is there. It's a perception that something is there and needs to be picked. So sometimes there might not actually be anything there, but you feel like there's something there. So that's why I'm not actually sure. Um, but again, the question is, does it bother you? Okay. So you're a picker. Okay. Yes, you're a picker. Okay. So the dermatologist can treat the things that are bothering you on your skin. If they go away, you'll see. You'll see if you continue to pick or not. But the main question is, does it bother you? Does it bother you, and does it interfere with your life and your activities? So things to think about. Is seeing a dermatologist beneficial? Also, how do I stop picking at night? So you don't have to see a dermatologist. Dermatologists are helpful if you have skin conditions that contribute to your urges. So dermatologists will treat your skin. Okay, so for example, acne. Acne is a really common trigger, um, and so a dermatologist can help treat the acne. Um, if you I lost my train of thought there, but sorry about that. Oh, if you are having um like skin infections, frequent infections, or having trouble healing um your lesions, your wounds, a dermatologist is a good person to be connected with, again, just so they could help you with that. It's not necessary, but it's a good additional support to have. Okay. So stop picking at night. So yeah, so nighttime picking is a really common time, usually because people are tired. You're winding down, you're thinking about the day, maybe you're thinking about what you have to do. You're feeling stressed out. What do you got to do tomorrow? Am I going to get enough sleep? Um, so people tend to get stronger urges at night. Now, my follow-up question would be, are you picking at night while you're aware or not aware? So are you sleeping and picking and not aware, or are you picking as you're getting ready for bed? So if you are aware and picking as you're getting ready for bed at night, think about what your routine is and how you can change up your routine. What can you do differently? Maybe you got to change the time you're doing showers. Maybe you got to cover those mirrors, right? Keep lights dim. Maybe you have to um, do some reading for relaxation, but in on the floor, not in the bed, right? Maybe you want to have some fidgets by your bed. Maybe you want to do some breathing, meditation, body scans or something in bed as you're going to sleep to try to relax. Um, um, you can also think about, if you're in bed, if you're doing it while you're not aware, barriers, right? So maybe you want to go to bed with gloves on, or put some lotion, have a nice relaxing lotion routine at night. Maybe you want a weighted blanket, long sleeves, for example, long pants. Think about what you're wearing so you can block yourself. Again, it depends on where on your body you're picking. So those would be some quick things just to get you started. Hope that was helpful. Oh, just gonna scanning some of these questions. Oh, we got lots of questions. Okay. Okay. Getting ahead of myself here. I'm excited. Good questions. Um, let's see. Do you have any suggestions for how to guide my partner to react when I'm skin picking? Yep, I tried asking him to call me on it, but I just ended up feeling annoyed and embarrassed. Yeah, so yeah, so good question. So for a partner, or loved one, or a parent, anyone that you are living with, um, or anyone that you're around who sees you picking, calling you out on it. Hey, I see you, you're picking. Stop that, right? It's not going to work. What are you doing? Stop that. Put your hands down, right? Those are common reactions. It's not going to work. It's going to make you feel annoyed, right? And embarrassed, like you said. It's going to make you feel worse. And when you feel worse, you're just going to pick more, and you're going to sneak it, and you're going to do it later, and you're going to do more of it. So instead, things like starting a conversation with you. Oh, how was your day? Or oh, you seem like something's on your mind. Do you want to talk about it? Right? Or is something bothering you? Do you want to talk about it? Or they can sit next to you and hold rub massage your hand and say, oh, I'm so glad to see you today. Just offering some encouragement, some support like that. If they see you, they could offer you a fidget, right? Oh, I noticed. Hey, no worries, but I noticed that you're picking. Would you like me to give you a fidget right now? Right. So they can even ask you because you might not want it. you, you might be in the zone. Maybe you're stressed or overwhelmed with something. Maybe you don't want their help. Um, so think about how you want them to help you, as well. So yeah, they can ask you, do you want me to hand you a fidget? Um, or they can help you to kind of break out of that trance, and ask you to help them with something. Oh, hey, can you help me get that from over there? Right? Or um, can you, I want to really want to make this. Can you help me cook it? Or do you mind helping clearing the table? Things like that. So just to interrupt you, so you can do something else. Or even something like, um, I think I'm going to go on a walk. Do you want to come? Right. So if they want to do an activity to try to engage you in that other activity. Oh, I was thinking about um, playing a video game. You want to play like a two-person video game. Right. So just something to kind of break that cycle, and distract you, but also give you support. Okay. So try some of those things, and see if that helps. Sometimes when I catch myself picking, I don't want to stop. Yeah, as it's satisfying. Do you have any tips on how to counter that satisfying feeling? Whew. Yeah. So once you start, it's really, really, really hard to stop, because you're right. It is so satisfying. So, I mean, there are different competing responses, like an infinite number of things you can try, an infinite number of like fidget toys, right? Nothing is going to feel quite as satisfying, unfortunately. So it's about finding something that's close. Um, so I can't really tell you what's going to be close for you. So you have to kind of think about what what is satisfying about that feeling? What about it feels so good? So depending on what your answer is, that's kind of the direction you want to go in. So let's see. So for example, if you like, this kind of like a little pop feeling. Let's say you kind of like that little pop. I don't know how to describe it, but you know what I mean. So you might like, a fidget like this, where you like pop it, like bubble wrap, pop it, a little like tension. Um, right? Or you might like something like magnets, like that, I mean, that little pull, like that little tension, that little resistance. So something like that. Um, different squishy balls with different like bumps and balls inside of them, different textured things might be satisfying for you. So again, I can't really tell you. You're gonna have to kind of think about what that feeling is for you, but know that nothing is going to quite feel as satisfying, unfortunately. But keep trying different things. Okay. Oh, does dermatillomania get harder to treat the longer you have had it? Good question. I don't know. I mean, I want to say yes and no, actually, because if you start treatment really early, like as soon as you develop it and you recognize it and you get treatment really early on, you're more likely to be able to use those strategies and skills and kind of get into those patterns quickly. So you're in the beginning when you're just like fresh into it. Um, if you've been doing it for years and years and years, you're really you're really in it, which is common. So there's nothing bad about that. It's just you're in it. So it's is it harder the long so it might be. I mean it also depends on I think it depends on a lot of factors. So if you've had it for a really, really long time, but you've never knew it had a name and you never had treatment for it, then when you're going into treatment, it's fresh, it's new, it's exciting, um, and the more likely it will be helpful for you because it's new information, it's new knowledge. So that's why I say kind of yes and no. So I think it just depends on the person. If you've had it a really long time and you've been to specialists and you're still struggling, then I mean it's hard. This disorder is hard. And I wish there was a magic answer. And I wish it was easier. But it is a chronic disorder and it's hard. So I wish I had a better answer. But keep trying. Keep trying and know that you're not alone. Support on you know, things change, your environment changes, situations change, you change. So again, it could get easier, it could get harder. It just depends. Um, what are the best tools for clinicians helping a tween with picking? Yeah, yeah. So for teenagers or tweens, the same thing, the same treatments for adults, right? You're doing the same thing. Um, First step is kind of working on awareness. So helping, doing kind of self-monitoring to help with awareness of thoughts, of feelings, of situations, what's happening, right? What is the urge trying to tell them? So learning about patterns. And once you learn about patterns, then you can start to work on strategies that you can experiment with different stimulus controls and competing responses, different mindfulness things, paying attention to your thoughts, maybe rephrasing. So the impact of your thoughts and your feelings, right? The impact of the place of body position. So all of those things um, you would be looking at and treating the same as adults. I think with tweens, though, you want to make it a little bit more fun. um, so, for example, when you're doing charting and working on strategies, I like to chart the strategies you're using. So, putting stars every time you use a strategy, and that could be really exciting in doing a reward system. So, I would say that's the biggest difference working with a tween is incorporating a reward system, rewards for using strategies, um, regardless if you're picking or not picking. It's all about using strategies and practicing so it becomes natural. Okay, hope that answers your question. So is there medication treatment for skin picking? So um, the short answer is no. There is no FDA approved medication, unfortunately. The good news is researchers are working on it. Who knows how long it will take? But it's a work in progress right now. There is an amino acid supplement which has been shown to be the most effective so far, and that's N-acetylcysteine or NAC. So right now, that is the only supplement that is quite promising. Memantine is another one that they're just starting to research and look into. And there's some other things related to glutamate that they are researching now as well. But right now, NAC is the most common one. Other than that, no medication. Ah, yeah, book recommendations. Yes. I have a lot of book recommendations. Let me see if I have it written down. Let me just get 1 second. Okay, so book recommendations. I would say the number one book recommendation is called Overcoming Body Focused Repetitive Behaviors, a comprehensive behavioral treatment for hair pullers and skin picking. So that's by Charles Mansueto, Sherry Mansfield, and Ruth Gollum. That's a real top one. Um, I would also recommend specifically, I guess, for dermatillomania, even though this is trichotillomania, I would still recommend it. Trichotillomania, an ACT enhanced behavioral therapy approach. So that's a workbook. It could be used for skin picking as well, even though it's called dermatillomania. That's by Douglas Woods and Michael Twohig. The newest book that's gaining in popularity that just came out, which is also really helpful, is called the BFRB Recovery Workbook. And that is by Marla Deibler and Renee Renardi. Okay, so those are just a couple of books I would say to start off with. And if you didn't quite catch that, again, you can watch the video again or just email us at support@skinpick.com and I can email you the list of book recommendations. Oh, okay. Um, what does the skin picking program include? So, good question. We have some webinars that go into a lot of detail about what the program is. But basically, the program is there are different levels of it, but the main level is that you are assigned a therapist who's a real person. I am one of the therapists. And we go through these sessions. So each session has information that you read, so an educational aspect, and then questions for you to answer. So kind of like worksheets. And then we as therapists respond to you within the worksheets. So within each session, we go back and forth talking about what you're learning, what you're experiencing, what your questions are. So that's kind of the basic format of the program. Um, there are additional features besides the sessions. So for example, there is the tracking, the self-monitoring section. So you can kind of record and monitor. There's some self-assessments in there. There's a journaling feature. There's cognitive diffusion features. There's a section where you can keep it separate and write down your strategies that you're working on, your competing response, your stimulus controls, for example. So there's a lot of different aspects to it. But the main aspect is that you're working with a therapist. It's through typing back and forth on these different sessions. Okay, check out the webinars that go into a lot more detail about what the program is. What are some possible replacement behaviors other than fidgets? Um, I mean, there are so many. I happen to like the fidgets a little bit better. But just to name a couple of examples of other competing responses. So, things like no fidgets, things like putting your hands in a fist and releasing, relaxing, right? Or shaking them out and relaxing. Um, Pulling on clothes, doing something opposite, right? Stretching, relaxing. Um, so kind of things like that. Sitting on your hands, holding your arms, right? Doing a little squeeze, massage, right? Squeeze, release. So those are just some other examples um, of a competing response that's not a fidget. Okay. Um, so things like fidgets, you can use fidgets at the same time as maybe giving yourself a massage. Same time as breathing, maybe doing some box breathing, for example. Maybe you want to do that at the same time as sitting on the floor instead of your desk. At the same time as changing the lighting of the room that you're in, right? So you want to do a combination of things. Okay. Yeah. So as a clinician, how can I help parents help their child with skin picking disorder? Um, well, first, I will mention that this program does have a parent program. So in the parent program, um, the parent is the one that goes through the sessions, so gets the education, and then passes it along to their child, so they can work with their child on the sessions, and they're kind of doing it together. Um, so I would recommend, if you're not sure, I would recommend the parent program. But basically, as a clinician, you're guiding the parents to help their child. Um, so educating the parents so that they can educate their child. Um, Making sure that the parents are still loving and supportive and caring and encouraging all of their other interests and activities. That's really important, um, and helping the child gain awareness. So helping them maybe doing some tracking or checking in. The parent plays a big role if you're using the reward system. Oh, did you use a strategy? Let's put a star on the chart, things like that. You do want to help the parents not be too overwhelming and not annoy their child. So there is a limit of how often they are going to be checking in with their child. The child does need space as well. So it's about finding the balance that works for the family. Oh, by the way, um, we do have a webinar for parents as well. So you can check that out and see if that also helps give you some information as a clinician, but also for the parents. Okay. Hi, someone says hi. Hi. Not a question, but I just bought some fidgets from Nido and other ones from the TikTok shop, um, and have been having some luck with those. Okay. I also have been loving the picking pads on there. Oh, I have mixed feelings about the picking pads. Someone asked about um, what is a strategy that will give them that close, satisfying feeling. So things like picking pads. Um, can come close, but sometimes I feel like it comes too close, um, and can maybe trigger urges, especially if you're, yeah. So sometimes some of these like picking products also have tools that come with them. So I don't really like that. Um, but again, everyone is different. So if you're finding something that you love and that's working for you, great. Like do what works for you. um, so I'm so glad that you found some strategies and some things that work for you. So good news. Keep at it. Okay. Do you know of any dietary or nutrition supplements that may lessen picking, perhaps NAC? Yep. So right now, as I mentioned before, right now NAC is the only one that's really been researched and that is the most promising and that is recommended. Um, so I would say NAC for right now. So yes, I agree with you. My client is a tween and skin picks, but also engages in rocking motions on a chair before bed in a repetitive and ritualistic way. Is this kind of a BFRB, or is it common for people to experience multiple BFRBs at the same time? So, rocking is not a BFRB. So that might be something else. That might be more of like a stim. Stimming is different from BFRBs. Um, but also, yes, it is common to have more than one BFRB. So it's really common for someone to be a skin picker and a hair puller, for example, or a skin picker and a nail biter. So yes, multiple BFRBs are quite common. Um, but the rocking before bed is not a BFRB. So that's something else. So they are still trying to soothe themselves, right, by rocking, but it's something different, not a BFRB. Okay. I'm new to trying to address this issue. Oh, where do I start? Do I need to see a counselor at the first step? And I've already seen a dermatologist, but I definitely have a BFRB of skin picking. I mean, you've already taken your first steps, right? You're here. Your first steps, I would say, are just getting information, right? Learning about it, reading articles, blogs, joining webinars, um, and seeing what you could learn. So that would be the first step. Next, I would say, yes, I would always recommend seeing a counselor or therapist, but a trained one. All right, so make sure they are knowledgeable of BFRBs. They have special training, um, and that way they can best help you. If you don't want to go one-on-one with a counselor, you can certainly join this program. I do think that this program is a really good beginning step, just because, again, it has that information educational aspect, and you're paired with a therapist. And then once you kind of get all of this knowledge and information and you finish the program, then if you want, then you can kind of you can continue with the program, but you can continue privately with a therapist that you find in your area as well. So it kind of gives you a nice base, I would say. Um, so yeah, keep getting educating yourself, joining things like this, learning about your disorder, doing some tracking. You don't need to see a therapist in order to do some tracking. So you can do some of your own self monitoring just to learn about what your patterns are. So I would say those are kind of the beginning steps. Okay, but I'm so glad that you discovered it, has a name, that you're here, and that you're on your journey. Oh, so I mentioned body scans before. So someone is asking, what is a body scan? So body scan is a really nice relaxation technique that kind of checks in with your body. So I like to do it at night. Some people also do it in the mornings. It's a nice way to kind of check in with yourself. So you can Google like body scan meditation, for example, or just body scans. Um, Body scan relaxation, and you'll kind of see a little bit more detailed instructions about what it is. But it's about basically going through your body and the different parts of your body, and it's kind of sending your energy and your thoughts to those different parts of your body and just checking in. How do you feel? And breathing, how does each part feel, and kind of feel it moving up your body. So it's just a nice way to check in with yourself, breathe and relax. Um, you can also search, by the way, I'm pretty sure we have webinars on body scans. So, um, and if not body scans, definitely on different relaxation and meditation techniques. So, something to check out if you're interested. Oh, can you show the fidget pen again? I missed it when you showed the first time. Yes, I have a lot of fidget pens. This is my newest one. I honestly, I found it on the street. So I'm sure you can find it on Amazon, but this one I got for free. But they have all sorts of fun fidget pens. Um, something like this. These are really great, especially for like kids and teens. Other kids and teens might steal them, but at least they can fidget with them. They also have, oh man, I don't have it right here. They also have, oh yes, I do have things like pencil toppers, or things you can put on your pencils. I don't think I can find my other ones, but that's a fun one, right? Yeah, so there are all sorts of different fidget pens. So even if you just Google like fidget pens or pen toppers, like you'll see a ton of them. And just see which ones like appeal to you. Yeah, but they're pretty fun. Okay. Um, I am okay. I'm just noticing the time. I'm gonna keep going, and I'll kind of reevaluate in 5 minutes. So I do want to just be mindful of the time. Um, can you actually stop picking forever, or is it like alcoholism? So, well, it's not like alcoholism, but there are some similarities. Um, but the question about stopping picking forever, again, this is kind of like a yes and no answer because skin picking disorder is a chronic disorder. So what that means is a part of it is always going to be within you. That doesn't mean it's always going to be active, though. So it can certainly kind of like deactivate and go dormant for a very long time, maybe forever. Um, but a part of it is always going to be in you. So you don't necessarily know if it's going to be triggered again, if it's deactivated. Um, so unfortunately, um, also unfortunately because this is chronic, it's really hard to research this because you can't follow a person forever. So there's no actual way of knowing if a person can stop forever, just because there's no way to research that. There have been many studies following people for an extended period of time, but not forever, so it's just really hard to know. So just remember, it is chronic, but it doesn't mean that it's going to always be active. So if it does come back after being inactive for a long time, it could it could come back very quickly. You could manage it very quickly because you know more about it. Um, right. So it could be just like a quick slip, and then you're back on track because you have so much more knowledge and you have so much more skill and confident with your strategies. Um, So even if it does come back, you can still kind of manage it and help it to be dormant again. So it doesn't necessarily mean that it's going to impact your life forever. Okay, a couple of questions that are repeats. I'm going to skip that. Um, um, so I will repeat, there is no medication, unfortunately, for this. Someone is asking, are there any particular antidepressants or other types of medication that's generally effective for this disorder? So again, the answer is no, unfortunately. If you have a co-occurring disorder like depression or anxiety, for example, and you take a medication for your depression or for your anxiety, that can help, because certainly depression and anxiety can impact your urges. So taking other medications for your other disorders can help. Um, but it's going to help kind of indirectly. It's not going to help the actual disorder of skin picking. It's going to help the depression. It's going to help with the anxiety, um, which can help with urges, um, but not necessarily because there are a lot of potential triggers. That's just one part of it. Ah, not a question, but it's so amazing and refreshing to hear someone that gets it, like really gets it. I do really get it. I get it. Um, yeah, you're welcome. It's hard to get it, but I get it. I'm with you. Um, So there is no chat feature in this format. So if you have follow-up questions or you want specific answers, like someone is asking about the books that I recommended, please just email us at support at skinpick.com, and I will email you those book recommendations. Yeah, no problem. So just send us an email. Support at skinpick.com. Someone is asking how long the program is. So I don't remember how many there's a set number of sessions um, that you can go through. That's like the core curriculum sessions, but then there are additional sessions. So depending on the individual needs and what's going on, we can add sessions to your program. So I can't really answer how long the program is. So it just really depends on you. Um, but I do suggest checking out that webinar about the program, about the Skin Pit program, because you'll learn a lot more from there. Um, so it's really individualized. So you can kind of go beyond the core curriculum. You can add more sessions. You can finish all that and like it so much that you just want to stay on and chat with your therapist. That happens too, and that happens quite frequently. So even if you finish the whole program, you still might want ongoing support, and you're welcome to stay on and do that. And some people choose not to finish the program as well. Maybe they feel like they got what they wanted in the very beginning, and they don't want to do the whole thing. So you can kind of stop it at any time. It's really up to you. I do recommend if you join to do the whole program, just to get the most out of it. So is BFRB a type of obsessive compulsive disorder, or is that different? So it's different. Um, it's kind of like a cousin to OCD. We have a really great webinar. I'm not going to go into great detail on this question right now just because of time, but there are a lot of differences. So check out that webinar. I think it's called like BFRBs and OCD. It's a really great webinar, and it will explain that much more in depth. But, but basically, they're like they're different, and they respond to different forms of treatment. So those are some key differences to think about. Okay, how would I explain skin picking to my mom? Because I've told her I can't just stop, but she doesn't believe me. Yeah, people who don't have BFRBs, they don't get it. They're like, well, why don't you just stop, right? No, well, obviously, of course, if you could stop, you would, because obviously you don't want to be doing this. But it's part of the disorder. It's like you can't quite help it because it feels really good. So how can you explain it? Um, so besides giving your mom like information like come to these webinars, check them out. Um, there's a really good one woman show. Um, that I recommend watching as well. It's really powerful. I think it's called Trick. So I do recommend that. It's a really nice way to help explain to others what it feels like, what it's like to go through and live through this. Um, Although that one is focusing on hair pulling, not skin picking. But I still recommend it. Um, but for skin picking in general, webinars like this, blogs, articles, um, again, check out the parent. She can check out the parent webinar. I think that would be really helpful for her. Um, and I like to explain it if you're already educating her and she's not understanding it. I like to explain it in a couple of different ways. Um, I like to explain it like try not to blink. Right? See how long you can keep your eyes open for. Oops, I already blinked. Um, and notice that feeling of what it's like to try to resist blinking. That's what an urge feels like. Um, right? Or walk around all day with a pebble in your shoe. Right? You feel it, it's there, it's annoying. How long can you last without taking the pebble out of your shoe? Um, Probably not that long. So that's kind of what it feels like. And I like those two examples um, because they're two examples that they could really relate to. Oh, and another fun example that I like to give. I don't know if it would work as much with your mom, depending on the generation of your mom, but I like to give the example of how long can you go without looking at a phone notification? Right? You see that little notification, you got mail, or you got a text, or whatever, a Facebook notification. How long can you go without looking to see what that notification is? It's hard. Um, and in fact, that way of thinking about it is also an interesting way to practice resisting urges, interestingly enough. So if you have phone notifications, resist looking at your phone notifications because it's kind of working a similar muscle, similar resistant muscle. So it's kind of a nice way to practice without directly practicing not picking. It's practicing not looking at your phone notifications. It's strangely helpful. So try that. So try explaining that to your mom. Maybe that will help her understand a little bit more about what it feels like and point her in the direction of some of these webinars and articles. Okay. Oh yeah, I love the pen. Great. Yeah, there's some good fun ones out there. Thank you. Okay. I know I kind of sped through a lot of the questions today. Partly because I'm under the weather, and partly because of yeah, weird computer issues tonight. So if there are other questions that come up that you think of later on, just email us. Okay, we'll be happy to answer them for you. Or you can also join another question and answer webinar. We do these like every other month. So if you want to join again, feel free. We'll be here. So again, the email is support@skinpick.com if you have other questions or concerns. But otherwise, thank you so much for joining. And I'll see you next time. Take care and hope this was helpful. And someone just quickly wrote, yes, so this was recorded. So if you missed it, you'll have access to it. So no worries. No worries. It will be up and accessible so you can watch it again. And you can watch all of the past question and answer webinars that we've done, and you can join the next one. So lots of options. So you're welcome. Thank you. Thank you very much, everyone. Thanks for hanging out with me tonight. And take care. Gonna